Morning, everyone. We are Team Diabetes, and we are here to solve the problem that quietly disables millions diabetic foot ulcers. Our idea is simple, scalable, and emotional. And what if early detection was easy as chewing gum? And what if we could turn motivation into medicine? And let me show you how. India has 212 million people living with the diabetes, and one in four of them is at risk for developing diabetic foot ulcers, a complication that can lead to infection, amputation, and even death. In rural India, ulcers go undetected due to lack of access. In urban India, they are ignored due to lack of time. Across both, there is one big enemy: poor adherence, awareness, and to preventive care. It's not just medical issue; it's a behavioral issue. So we ask, can we make early detection more accessible? Can we make lifestyle modification feel less like a chore and more like a myth? This led us to create Salivate, a diagnostic gum that detects early biomarkers of diabetic foot ulcers, and Diavin, an app that scans, interprets, and motivates in a way that actually sticks. So let me show you how Salivate works. Here's how saliva works. When a person chews the gum, saliva comes into contact with gold nanoparticles bound to antibodies. If certain markers like IL-18, procalcitonin are elevated, the gum changes color. The user scans it with Diavin app, which detects risk and provides immediate guidance. No pain, no needles, just a chew. Science behind it. So why saliva? Because markers like pentraxin 3, IL-18, and procalcitonin show up in saliva during early diabetic foot disease. Well, before physical symptoms actually appear. This gum is low cost, portable, and non-invasive. It doesn't require a lab. It doesn't require electricity. This makes it ideal for rural areas, ASHA workers, and even school health checkups. Now, this is the mechanism of action of what we propose, and introducing Diavin app, the app that actually motivates. Now, detection is only the first step. Behavioral change, that's where the real battle lies. So that's where Diavin comes in. The app uses AI to scan the gum, assess the level of risk, and then provide personalized lifestyle coaching in the user's own language. And here's the emotional hook. We let the patient's motivation come in the voice of someone the user trusts, like child, spouse, or even a favorite public figure. So the key features of Diamond isn't just an app; it's a habit-building ecosystem. It includes risk prediction using behavioral data, disease stage tracking, daily goal setting, and habit streaks, voice-based encouragement using AI-generated voice cloning. And it supports all major Indian languages powered by Bharat GPT. It doesn't inform; it inspires. And the experience is gamified. We are inspired by platforms like Duolingo. That's why we gamified Diamond. Users can earn streaks for daily activity, get instant feedback, and even track how much future healthcare costs they are avoiding by staying consistent. And it's behavioral change through reward and not fear. And to build, it's built to make the patient feel like they are winning every single day. So these are our stakeholders. The people with diabetes, general population, doctors, ASHA workers, community healthcare workers, health policy makers, and government. And the impact potential. Early detection and lifestyle adherence can reduce the need for amputations by 80, up to 85%. Imagine the ripple effect of deploying this in rural clinics, urban OPDs, school or workplace, healthcare and healthcare drives. Diamond bridges both the gaps, a gap in detection and the gap in motivation, and it does so with empathy and accessibility. Every part of Diamond is technically feasible. Salivary diagnostics are backed by strong biomarker research. Gold nanoparticles are well established in biosensing. Image recognition via smartphone cameras is now a standard thing. Bharat GPT enables multilingual engagement, and AI voice cloning is mature enough to create emotional connect. We are not reinventing anything. We are just making it usable. We are just making science which already exists usable lovable, and scalable. So the clinical feasibility. We know that the rural populations might not be using the smartphones as frequently as we think. So we thought of making voice notifications which would help them get them reminded. And salivate remains unfazed even in the face of rural areas because it is the low cost way to detect diabetic foot ulcers as early as possible. And so, our vision for the future. We want to propose a government-backed pilot program starting with one department, such as health workers or railways. Employees would receive salivate gum and access to Diavin for 3 months. We track engagement, biometric improvement, and adherence. The goal to prove that public health outcomes can improve dramatically, not just through medical tech, but through behavioral intelligence. And while while a lot of people might focus on AI for diagnosis, we focused on the missing link. We focus on the missing link on chronic disease care, which is behavior. We built a full loop from non-invasive detection to emotionally resonant motivation. Our project combines affordability, innovation, and heart. And in a country where prevention is the only cure we can afford, we believe Diavin can actually change lives. Thank you. Signing off, Team 28.